I'd like to welcome you to this edition of the PRS Journal Club podcast with your hosts, Dr. Sammy, Sinno, Amanda Silva, and Raj Sawh-Martinez. Enjoy.
Welcome, everyone, to the September 2016 PRS Journal Club podcast. I'm Amanda Silva, and I'm joined by my fellow PRS resident ambassadors, Sammy, Sinno, and Raj Sawh-Martinez. Today, we welcome our guest discussant, Dr. Liza Wu. Dr. Wu completed her plastic surgery training at the University of Chicago and a microsurgery fellowship at MD Anderson. After completing her fellowship, she joined the UPenn team, where she's currently an associate professor and the microsurgery fellowship program director. Thanks, Dr. Wu, for taking the time to come and discuss with us today.
Well, thank you for inviting me.
Yeah. Today we'll first be discussing an article by Yao et al. Out of USC entitled The Medical Mission in Modern Core Competency Training, a 10-year follow-up of resident experiences in global plastic surgery. So this group has previously reported on their resident participation in medical mission and how it advances educational growth in the Acgme core competencies. And with this project, they sought to examine the long-term impact of global surgical experience on the careers of participants, the populations they serve, and on the potential impact of global surgery capacity. They surveyed 208 plastic surgeons who have completed the Operation Smile Reagan Stryker Fellowship between 2006 and 2015. And for some background, the Operation Smile Reagan Stryker Fellowship is a program that consists of a 2-week experience, and it includes a surgical mission with a follow-up debriefing meeting. The survey consisted of 60 simple free response questions and a 3-level Likert scale question. The questions focused on the fellowship's impact on Acgme core competencies, career motivations and trajectory, and populations served in global health capacity. The response rate was pretty impressive at 79%. When you look at Table 1, that shows all of the current demographics of people who participated in the fellowship. About half of fellows are from North America, about half are currently attending. They represent a variety of plastic surgery specialties. The most common fellowship that was completed by people who participated in this fellowship was PEDS or craniofacial, but it's a pretty well-rounded representation with people doing micro and hand fellowships as well. The majority of people are in academic practice and perform general plastic surgery. The majority are at the assistant or associate professor level, with a few program directors and chairs. And 100% of survey participants said that they would volunteer again. When you look at Table 2, it shows, it kind of is a nice layout of all of the Acgme core competencies and how they are improved by having this experience. So when you consider patient care, you're immersed in a culturally diverse setting. There's high-intensity clinical screening and operative planning. When you consider medical knowledge, there's a large volume of patient screenings and procedures which are done under direct mentorship. Over half of the people who responded to their survey said they did more than 25 surgeries on their trip. When you consider interpersonal and communication skills, participants improved these skills by working with new multidisciplinary teams on a daily basis. And when you consider professionalism, that was richly fostered as fellows would assume leadership positions, they offered mentorship to students and peers, and they networked with a culturally diverse group of professionals. The authors also point out that outside of the core competencies, you also gain additional benefits such as future leadership potential, lifelong lessons, awareness in resource management, and an appreciation of international partnerships and support for surgical capacity in resource-poor settings. Some interesting and important things that they point out in the discussion, which a lot of people talk about when they talk about these international experiences, is the importance of a cross-cultural exchange. And that's something that the fellows actually said was a really rich experience for them. They felt that they operated very often with local surgeons and were involved in educational exchanges with local staff. They also collaborated very often with the foreign institutions in research, and they found that to be some of the most rewarding aspects of their experience. The authors do point out that there is some possible selection bias. Residents who choose to participate in these missions are self-selected groups. They're more likely to value these types of experiences. But overall, I think this paper points out some very positive aspects of international experiences for residents. And they also surprisingly point out that only about 12% of surgery programs offer these formal electives. So now I would just turn it over to everyone for discussion. I'd be curious if anyone's ever been involved with these and what their experiences have been, or if their programs have these opportunities.
Yeah, so Amanda, that was a great overview of the paper. And I think they bring up a very, very interesting point that, with traditional residency training, I think achieving the core competency can be challenging. And what are other ways that you can kind of explore, that we can expose our residents to, that will hit some of these other core competencies that through traditional residency training aren't really addressed?
Mm-hmm.
So, and I think medical missions, international medical missions and specifically, is an interesting avenue to explore. But then the question is, where exactly are they going with this paper? Is it feasible to basically offer every surgical resident an international experience? I mean, what do you guys think? Have you guys been through it during your residency? Is there a opportunity to do something like this?
Go ahead, Raj. No, go ahead, please.
Sure. Well, I was just going to say, part of our program, we've actually had a fairly strong support of that in our fifth year. The fifth-year residents essentially supported through hospital and university funds to do a medical mission. And most times, I think just about all 12 residents currently have done something of some kind, either as a medical student or planning to now, and will inclusively do a couple during their vacation months. And Yale sort of started a program where if you're a resident, you're going on a trip, they'll essentially fund it if it's with a university affiliated faculty. There's no formal scholarship really, but there's sort of that strong tradition. And our program supports, no matter what, someone doing their fifth year to go. We've had a couple of residents who've been very involved with Operation Smile as well throughout the years. And I think it's, I agree, Dr. Wood, the question is how does this translate into a more national model or embedded into, an RRC standard, let's say, for programs. But on the front, as far as competency, cultural competency, and this, push towards academics and really understanding some of the factors involved in developing nation surgery and what the impacts there are, it's obviously sort of an invaluable experience that I think even for a lot of plastic surgeons, it's sort of shaped their careers and shaped even medical students' interest in plastic surgery. So from our standpoint, it's sort of wholehearted agreement and certainly support from here by the value of international work and how that can impact careers.
Mm-hmm. Mm-hmm.
Yeah, I wish our program actually had more opportunities to go abroad. From what I understand, there's not an easy way for the university to allow us as residents to be able to go abroad. I think some of our liability gets in the way from that perspective, and we don't maybe have as rich of a tradition of doing that in our program as maybe Raj and Amanda do at their programs. So it's always something that I thought should be added to our program, not that maybe you have to go, but that you should be able to take an elective 2 weeks to be able to go on a mission trip. We do have a lot of excellent cleft and craniofacial surgeons who actually go themselves and perform surgery in other countries, but there's no mechanism built in right now for residents to allow them to go spend time with them, and that's something that I hope that we're able to build in the next several years.
Mm-hmm. Mm-hmm. And Amanda, what kind of exposure or opportunity do you have?
Yeah, so at University of Chicago, it's been a tradition for a pretty long time where in your final year there's 1 week trip to the Dominican Republic, and both chief residents go down there. And it's sometimes some of our attendings go down. Lately, we've been partnering up with UNC, so we see a lot of the UNC faculty down there. But it's a great experience. Everyone really loves doing it, and it's just built in. It's not considered vacation time, so it's been great.
Yes. So I also went to University of Chicago for residency, and I had the opportunity to go as a medical student and 2 or 3 times as a resident. And I'll have to tell you that my experience, much like what this paper is trying to say, was incredibly impactful. And I think it's because you're totally immersed into an experience that is culturally different, that has a different type of medical delivery system than what we're used to. So it is incredibly rewarding. But my question to you guys, again, I'm bringing it back to kind of what the paper claims, that international medical missions develop core competencies in the long term. And again, what kind of model can we put forth nationally, and is there a better model that we could put forth nationally that would actually work? So my challenge to you is basically to ask the question. International medical missions, so they develop core competency in the long term. Did this paper basically answer that question? So my feeling is this. So they interviewed these fellows from 2006 to 2015, and I think the average year post fellowship was approximately 3 years of this survey. Mm-hmm. So when they say long term, like 10 years, that actually isn't the response that they got. The response they got was mostly people the average was 3 years out from their fellowship. Mm-hmm. But you still can't deny that the respondents, 79% of these people felt overwhelmingly that it did help their core competencies. But again, really it reflects the average of 3 years, not what they're claiming long term or 10 years. Mm-hmm. There is selection bias. I do certainly think that people who seek out these opportunities are somewhat more in tune and open to these type of opportunities. There's also negatives and shortcomings of medical missions. And honestly, there's variable experiences. I was involved in 3 or 4 medical missions as a medical student, a resident, and one I went, and it was very much what they describe. You evaluate 50 people in a half-day setting. You operate on 10 a day. You're getting these huge volumes. And then I'm involved in medical missions in which we do 1 case a day. Mm-hmm. And there's 3 or 4 patients that I saw in clinic. So again, these experiences can be very variable. They were all great, and I got something out of every single one of them. But again, it's one of those things where, it's not uniform across the board. And how do you implement something like this? And then they kind of emphasize on cultural competency and what these medical missions do. And I kind of argue that spending 2 weeks in another country that you may or may not continue to have a relationship with is developing any sort of cultural competency. So again, maybe more feasible would be taking residents and putting them in a different type of medical delivery environment in the United States, perhaps 1, 2, 3, 4, 5 hours away from their home base, where they're interacting with people that they will probably interact with in their future professions. So underserved, areas, people who are culturally or racially different than they are, but not having to leave the country to do that sort of thing. Mm-hmm. So again, I think their proposal and is valid, and again, it's one of those things where I've participated in medical missions, and I thought it was wonderful and it was great, and I love the experience. But I question what they're trying to say through their paper, what they would want to implement long term. What are your guys' thoughts?
Yeah, I agree. I think you brought up some very good points. I think exactly when you look at the survey, you are surveying people who aren't very far out, and as the authors pointed out, and you pointed out as well, the fact that this is a group of people who chose to do this, who had a great experience. Of course, everything is going to be positive in these survey results. And right. I think it's very astute also to mention the idea of helping out at home and becoming more familiar with your own community, patients who are closer to home who are in need as well, and reaching out to the community and learning through that, and not necessarily needing to go away for a week, which is potentially very difficult for programs to have residents gone for a week and to allow them to do that without vacation time.
It's just hard to standardize something and mandate it across all programs, because as we know, there are some programs where they have no problem meeting their Acgme requirements, and there's others that it's a stretch, and for those programs where it's a stretch to go to do 2 or 3 weeks of variable experience mission work may not be conducive. And similarly, in programs that are very busy clinically, they may not have enough house staff support to cover people away. That could also be tricky. I think what would be great is if there was a service component as they start building the milestone project, and there was some clear, tangible way that you could demonstrate some activity during residency, whether it's helping out in clinics on a weekend or two, or whether it's a formal elective mission trip, or like you said, community work that could be a part of our formal residency curriculum. But I think that's tough to do, and an algorithm for that is probably going to take some work by the Acgme and the program directors.
Yep, absolutely.
And just bouncing off a little bit of what you guys are saying, and I think, Dr., you bring up tons of great points, and not the least of which, at least in my mind as well, are just in general with these surgical aid trips, which come in multiple varieties. What are the underlying goals of them? They talk. Right. Some of the critiques are medical tourism versus long-term care, and you're providing a really sort of high-end service, and then what is the follow-up? Are you developing the community itself? Are these sustainable programs overall? And these have nothing to do with our surgical development from the resident standpoint. So I think there's a lot of complexity overall. But one of the strengths I think with the studies, they're really looking at competency development. And cultural competency, I feel like in surgical programs, especially in plastic surgery, often I would guess, usually takes a backseat to the, large number of things that we need to learn, becoming a good clinician, learning the procedures, learning the anatomy, et cetera. It sometimes may fall to the wayside, but I think this is an important corollary to that. And, I think you guys are absolutely right. I mean, it's very hard to standardize that across the board for all programs. And we, just in our 3 examples, very sort of somewhat different approaches within programs to have this as an opportunity at all. But I think even for the people who may go on missions who may not be the self-selected, interested people already, I do think if looking through the listing of the core competencies, there are certain things I think everyone still somewhat gets out of it. The ability, the forming partnerships with people in the local area, and I think there are some strengths of these missions that I think if there's a way to standardize an experience, or at least learn from the best practices of groups, that there may be a value in trying to create a cultural competency curriculum that is a standard within our programs. And I think that's what, at least that's what I take away from this the manuscript here, is that we're trying to use these cultural experiences by providing surgical care to underserved communities. And Dr. Wu makes a great point. They can be both at home or abroad, to really sort of help us continue to develop as leaders. So I think that understanding of the complexity in the system is what truly makes surgical leaders. At least that's my 2 cents on what I've seen. So I don't know what your thoughts are. Do you think that there's still a value in creating this overall nationally, or do you think that there's too much complexity to really have that be a reality?
Well, I think you hit on a great point that, something that is glaringly missing from residency training is this whole kind of new topic of cultural competency and kind of cultural diversity awareness. There's no formal curriculum for it in residency training. There are, if you probably, and half the time you guys probably get emails about it and you just delete it because, right, you're in the operating room taking care of patients. You can't spend the whole day in a symposium put on by your hospital where they invite, all these people to come and talk about cultural competency and it doesn't really relate to you. So, and nor are you encouraged really to go. But I know that where I'm from, they offer these things, but again, it's kind of not pertinent to your education right now. You're not given time to attend these things because you have other responsibilities. And I think it's something that residency programs need to have some sort of formal curriculum for. And one way to go about it is not maybe a symposium where you sit down and listen to 6 or 7 different lectures from social scientists, is actually some sort of immersion, some sort of clinical rotation in which you're either put, as a medical mission either overseas or maybe in some community close to home that is different than what you're used to at your home base. I think that would be very valuable, I think it would take a lot to implement something like that across the board nationally. Maybe what you can do is set up centers, have a few in each geographic location, and then send residents 1 week or 2 weeks out of whatever years, year 4 and 5 or 3 and 2 or whatever, and that be some sort of formal training and curriculum.
Yeah, I think lots of great thoughts, and that's I think we pretty much end on that note, because that was a wonderful way to kind of conclude everything and bring it all back to center. So thank you, everyone. We'll move on to the next one.